Dr. Abhik, can you share trends about medical travel to India?
Well, let me give you that. Let me tell you, India has a strength of its own. Our history has given us a lot of confidence. You may know, Shivank, that our medical history is almost 5,000 years old, which started from Shushrut, who was our first surgeon, who was doing plastic surgeries, dental surgeries 3,800 years back. And we have been writing the Upchar Sanhitas in 5,000 years back, which talks about all those natural medicines, remedies, etc., which helps patients get treated. And this Sanhitas or the scientific books are 5,000 years old. So our history of Ayurveda, our history of Ayush, our history of yogic sciences is one of the most ancient histories in the world. And people, even at that point of time when Shushrut was operating, have been traveling from Middle East into us, and we were Devnagar at that point of time. We were Sindhu Ghati Sabhyata or the Indus Valley civilization at that point of time. People have been traveling from Middle East and Central Asia into India, into the Indus Valley civilization, into the banks of Ganga and Brahmaputra, and into the banks of Indus Valley to get treated by our famous doctors, even 3,800 years back. If I come down to current scenario, you will be surprised, Shivank, if you go to the Western world. Every fifth doctor today is an Indian doctor. That talks about the medical education that we have been serving. India produces close to 50,000 doctors every year and almost 2,800 doctors who are postgraduates every year. Medical education system which has put India in the health delivery. And we are 1.3 billion. There is no lot of patients. We have enough doctors and enough patients, giving the doctors enough practice to get the best skills out of them. And because there is such high supply and such high demand, our experience of treating doctors is what has been creating even as well, creating super medical institutions with corporates putting in them in the head. India has always been known for the hospitality. Yeah. Our people, the patient care system, our case managers, they are one of the most renowned hosts in the world. Atitya Devo Bhav. That's in Sanskrit, which means our guest is God. And each and every patient, international patient visiting India is our guest and becomes God. So we go all heads to toe to serve that patient as we would have served our gods. Hospitality is a big, big advantage. And that brings into the language expertise. Given that all our population is very young, India is a very young population. They go all out to learn different kind of languages. Our population speaks, select population of course. Everybody speaks Hindi and English, but select population do speak French, Arabic, Russian, Uzbek, Kazakh of a language. So people coming in from any country can be served. Let us also know that there are a huge population of international students who are here who chip in when it comes to serve a patient from any particular country. So if I have to summarize this whole thing, we have a huge history, our costs are low, we have some most skillful doctors, our infrastructure, the quality of technology is one of the top in the world, giving us the technological edge. Our hospitality is supreme, waiting times are zero, and everything put together makes India the capital of world